Today I'm bringing you the latest updates in women's health. I'm focusing on important changes to menopausal hormone therapy labeling from the FDA. For decades, the role of estrogen replacement for perimenopausal and menopausal women have sparked discussion. In the 1940s, studies showed women who had both ovaries removed before menopause faced higher risk of cardiovascular disease, suggesting estrogen may protect the heart. Now, the FDA approved the first hormone therapy formulations in 1942 to treat menopausal symptoms. Modern research shows that starting hormone therapy within 10 years of menopause can offer long-term benefits, including reduced hot flashes and night sweats, up to a 50% lower risk of fractures, up to a 64% reduced risk of cognitive decline, and 35% lower risk of Alzheimer's disease. Simply put, hormone therapy can profoundly improve quality of life for women in their early postmenopausal years. However, in 2002, the Women's Health Initiative, or the WHI, study raised concerns about breast cancer and cardiovascular risk, leading to declines in prescriptions. Later analysis showed these risks were tied to a specific progesterone formulation, medroxyprogesterone acetate, rarely used today. Now, the other thing is timing matters. Women who start therapy closer to menopause, usually younger than 60, see benefits outweigh the risk. Delaying therapy into later years may invert these benefits. Since 2003, FDA box warnings highlighted the potential risk of hormone therapy: cardiovascular disease, thromboembolism, breast cancer, probable dementia. Now, these warnings were applied class-wide, discouraging use even when therapy could help. Now, after decades of research, the FDA has revised these labels. Revise them. Key changes include removal of that box warning for most hormone therapy products, except systemic estrogen in women with a uterus to prevent endometrial cancer. No longer requiring therapy to be used at the lowest dose for shortest duration. Safety information tailored to the specific type of therapy, systemic versus topical. Updated guidance on starting therapy within 10 years of menopause. Now, these are changes, folks. For topical vaginal estrogen, labels now focus on safety specific to local use, separating it from systemic risk. And urology's been using vaginal estrogens for a long time. These changes aim to reduce unnecessary fear and help millions of women safely benefit from hormone therapy. The message is crystal clear. Hormone therapy can be safe and effective when tailored to the individual, considering their age, their symptoms, and the formulation of estrogens that you're using. The updated label reflects evidence-based, nuanced communication that can guide clinicians and patients in making informed decisions. That's the latest from the FDA on menopausal hormone therapy. Stay informed, discuss your options with your healthcare provider, and know that timing, formulation, and individual needs, they're critical. Now, tomorrow on UroNurse News, we're turning out the lights. Literally. Recent studies suggest that even a small amount of light exposure while you sleep could be quietly affecting your heart health. Could that glowing alarm clock, night light, phone screen be putting extra strain on your cardiovascular system? Join me as I uncover how sleeping with the lights on might be hurting your heart and what you can do tonight to protect it. Hey, tonight on Dr. Jeff Talks About Sex and Intimacy, Dr. Jeff is joined as he sits down with Dr. David Luendo to explore the often overlooked role of the urogenital diaphragm in sexual health and intimacy. Discover how breath, body awareness, and targeted techniques can enhance connection, comfort, and pleasure. Tune in tonight for insights that could transform the way you experience intimacy. Don't miss it tonight, 7 p.m. on drjeffsextalk.com. For more updates, don't forget to like and subscribe, and see you all tomorrow.
UroNurse News, we've got the scoop, helping you stay in a healthcare loop. From Monday to Friday, we bring the snooze straight to you.